Hello, everyone, and welcome to McGill Cares, a webcast series supporting family and informal caregivers. I'm Claire Webster, a former caregiver, certified dementia care consultant, and founder of McGill University's Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee the program, who include Dr. José Moret from the Division of Geriatric Medicine, Dr. Serge Gauthier, Professor Emeritus formerly of the McGill University Research Center for Studies in Aging, who are joining me today, along with our colleague, Dr. Isabelle Jalina, Associate Professor and Graduate Program Director at the School of Physical and Occupational Therapy for McGill University. Today is a special edition of McGill Cares, as we are launching a very important resource, and I must admit, my dream project, thanks to the generous funding that we received from the Grace Dart Foundation. The project is Dementia, Your Companion Guide, which is a free resource designed to assist people living with dementia and their care partners with information on the science and progression of dementia and practical advice on safety and self-care. Led by Dr. Serge Gauthier and the McGill Dementia Education Program, this project involved the collaboration of a team of multidisciplinary healthcare professionals who all came together to support this initiative, including the McGill University Research Center for Studies in Aging, the Division of Geriatric Medicine, the McGill School of Physical and Occupational Therapy, the McGill School of Social Work, the Alzheimer's Society of Montreal, and the McGill Office of Education Technology and E-Learning. I mean, this program is really, or this booklet is really a testament of what happens when teams work together. My colleagues and I are joined today by our special guest, Elise Nesbitt, president of the Grace Dart Foundation. Ms. Nesbitt is an entrepreneur and board member of various Montreal nonprofit organizations. Recently, she has focused most of her attention on the aging population within the Montreal community and the services provided to seniors and the innovative grassroots organizations that are finding solutions and services to meet their needs. Welcome, Elise, to McGill Cares.
Thank you, Claire, and hello to everyone.
So I'd like to start off by asking you to talk to us about the Grace Dart Foundation. What is the mission of your organization?
Well, as you described it well in your introduction, we support the well-being of the elderly in our community in the greater Montreal area. But I'd like to expand a little bit. So our foundation has identified 5 main areas in which we give. So firstly, we give for basic needs. This could be anything from housing assistance to supplying toothbrushes for the elderly. Secondly, loneliness and isolation, which of course we've seen a lot in the last few years. But this would include music and pet therapy, as well as support programs in person or online. Thirdly, we support socialization and personal development. This is more creative programs that give people a chance to get involved in their community and generally continue to be active. And fourthly, cognitive disorders. So this would be where your booklet falls. So we support activities and tools like this to help people suffering from cognitive disorders. And lastly, living environment. So this is so important and often overlooked. Just because you're elderly, it does not make you sort of boring or bedridden. We support building self-esteem and creating a pleasant living environment. So the most simple pleasure of smelling toast in the morning can create a home environment and make the biggest difference for somebody in their elder years. Thank you.
So what is the Grace Dart Foundation identified as the greatest needs for seniors, and especially in light of the pandemic?
Well, this I'll keep very simple. For us at the Grace Dart, the greatest need for seniors is to be respected and acknowledged as a member of our community. And as we get older, obviously we need more help in our everyday lives and likely more medical attention as well. So, given the recent, or should I say current COVID situation, we've also realized the importance of providing services with the aim to let no person be forgotten. Thank you.
So I cannot tell you how incredibly grateful I am for the support of the Grey Start Foundation. As I mentioned earlier, this is my absolute dream project of so many projects that I'm working on. As a former caregiver who was provided with this diagnosis many years ago and not being provided with any type of information, education, I always dreamt of having a prescription of care, something to provide family members and the person receiving the diagnosis. And so I know that your foundation is approached from so many, organizations with great ideas, but what motivated you to support this project in particular?
Well, Claire, I love to talk about what motivated us to do this booklet. Firstly, not only, as I've described, is it in line with our areas of giving, but it provides desperately needed information, to so many people. And building awareness about the importance to support those who care for the elderly has always been a top priority for us at the foundation. So as we've talked about before, be it a son, a daughter, husband, nurse, neighbor, whatever the relationship is, without proper support, the health of both the senior and the caregiver deteriorates. And in turn, that in fact, affects the entire family and spreads out into our community. So we are so pleased with the booklet, and I'd just like to take this opportunity to congratulate you, your entire team, for the hard work, dedication, the research that went into making it. It truly has been a pleasure working with you. So thank you all.
So I'm going to turn my next question to Dr. Moret, who's one of the co-medical directors of the McGill Dementia Education Program, and who works hands-on in the Jewish General Hospital, at the Montreal General, at the Glen. On a daily basis, you're working with the patients. So I had this idea, but what led you to support the idea to create such a booklet?
Hi, everyone. Very good question. But I would say that I noticed that the need for the booklet came from those who were participating in our workshops. They felt that what we teach, what we present is extremely helpful, but they feel at the end that they should have something concrete with them so that they can refer to. And this is what motivated me to support the creation of this booklet, because there is a need to inform all of the caregivers and the people living with dementia. And this can be a reference book for a general audience. The content is not scientific, but it tells you the present situation of the condition. And Dr. Gauthier will describe in more detail the different components of it. But as you know, the Dementia Education Program was created mainly to educate, but by the same effect to empower people living with dementia and their caregivers. And I think this book will be a great complement to our workshops and should benefit a large number of people dealing with dementia issues.
So how do you see this booklet being used within the healthcare system as well as within the university? As a professor at McGill University and Dr. Moret, you're teaching the medical students, how can this booklet be used not only in the healthcare system, but at the university level?
Well, I think there is a great need to start with, as I mentioned, because dementia is very prevalent. So in concrete terms, this book should be available in all clinics, family medicine, as well as geriatrics, neurology, even in emergency room. But it can serve as well to medical students, to students in the allied health domains, physio, occupational therapy, social workers, because it is a great tool. It presents the topics in a very concrete, practical way different topics that is of concern to people. Sometimes what we think is important as physicians, specialists, does not match what people want to learn. And this book was made in such a way that it will assist the caregivers and people living with dementia, so that understanding what is of concern to these future readers is important for medical students and all the students at the McGill Faculty of Medicine and Health Science.
So Dr. Marais, you, myself, Dr. Gauthier and Dr. Rosanetto, we had the privilege to be the senior co-editors of the World Alzheimer's Report that was just launched on the journey of a diagnosis of dementia last week. And what are some of the biggest challenges that families and patients face upon receiving a diagnosis, and how could this booklet address this?
Claire, it's quite clear that one of the greatest needs of caregivers and people living with dementia is lack of information. There's many reasons for that, including a lack of time with the physician interaction, but also having an information that responds to their perceived needs. And I think this book that focus on the disease itself, how it evolves, and the support that caregivers are in need of, would be a great complement to a book that describes how the dementia is diagnosed. Because once the diagnosis is made, this is when the journey starts, in fact. And having a book that will accompany the person, that will enable them to understand what the disease is and its progression, will empower them so they can face the challenges, the demands of the disease in a more serene way, I would say, though challenges are always challenges. And to deal with such a disease who has so much impact on so many domains of life, one needs to have resources other than just the book, for sure, but it has an essential effect and purpose that one cannot ignore. So I think it has a great future to assist caregivers looking after people living with dementia. Yeah.
So there may be many people watching today that have not even yet received the diagnosis or are concerned about their symptoms. And we are extremely privileged to have Dr. Serge Gauthier, a world-renowned neurologist who led this project. Not only did he lead the project for the Dementia Companion Guide, but he was also the lead editor on the World Alzheimer's Report. So I thought I would just take a minute to ask Dr. Gauthier, because again, people who are watching may not necessarily understand the journey of diagnosis, like what's involved. Could you just take a few minutes to explain that?
Pleasure. Bonjour tout le monde. So to make a long story short, all of us, we complain about our memory at certain times. We may be looking for a word or our cars. That's all normal. It's just when it becomes an impediment to daily life. And there's a gray zone that Isabelle can tell us about in a few minutes. When do you start to worry? So the diagnosis of cognitive decline can be made by the family doctor or other allied health professionals. If it's significant in daily life and you're younger than 70, probably you'll see a specialist such as a neurologist. If you're over 70, probably you'll see a geriatrician. If you have behavioral or psychological symptoms with the difficulty with your daily life, you may see a psychiatrist. So there's a multidisciplinary approach to the diagnosis. In terms of the steps, whoever you see, there's a history taking, there's a physical exam, there's a basic blood work, a basic memory test, and then there's a second visit where we re-evaluate the history, we redo some of the memory tests, and sometimes we're able to say to someone, you have mild cognitive impairment, you are forgetful, but it's not impeding daily life enough. So let's watch and see. And there's some advice to prevent this from getting worse, or you do have mild dementia, and this is what we're going to do about it. So one of the options for treatment now will be the booklet, and we'll go into the content in a few minutes.
So Dr. Gauthier, when I took my mother for her first appointment back in 2006 to see the neurologist at the time, I did not know, I was not prepared at all for this appointment. So what advice would you have for family members who are accompanying somebody to the doctor's appointment? Like, should I have a list of medications? Like, what should I bring with me?
This is a question that we have studied in the World Alzheimer Report that you mentioned. And one of the chapters is exactly that. How do you prepare? Essentially, you put together the questions that you have, the concerns you have, your medical history, your medications over the counter or prescribed. Come with someone who will help you find answers, especially about past medical history. So be prepared. The booklet goes a bit into that, also the World Alzheimer Report.
So now is the moment that we get to launch the booklet, and I'm going to ask Dr. Gauthier to just go over a bit the table of contents. But once again, this is the cover of the booklet. It's going to be available in English and French. And once again, I'd like to thank the Grace Dart Foundation for making this possible. So Dr. Gauthier, take us through the table of contents, please.
So this is the first of two parts. The first part is really written for the person living with dementia. It could be very mild stage, so they will really enjoy reading this, or it could be a little more, and then they may need help to go through this. There's a second part about more specific advice for the caregiver. As you can see, we start by general information about what is dementia, the staging, the common causes, associated conditions. This may be of interest to all the listeners because it's not just about dementia. It's also about common complaints about your memory, so-called subjective cognitive impairment. We go into that. The importance of depression as we get older. Depression can be masked, and it's one of the things we do as clinicians to try to find out is a bit of depression mixed with your memory complaints. Then we get into the safety and technology, proactive planning, and living with dementia. So this first part is really written for someone who has early stages of cognitive decline, who probably already had a first visit with a physician and now wants to read more. So when they come back for the follow-up visit, which may include disclosure of diagnosis, they will have already a bit in their mind some questions that they can discuss. Just some examples of the book outline. The pictures, the illustrations are very friendly. Some pictures are worth a lot of words, as you can see here, to define what is mild. We did give some examples of early stages, indicators, mostly about memory, but it could be about change in mood and behavior. Next slide, middle stage, some indicators, the kind of help you may need. And the next slide, please. Now we get into some specific conditions causing dementia. It's not technical. It's really written for the average person. And if you want to read more, then you go into the World Alzheimer Report, and we'll give you the reference for that. Yeah. And another slide about another condition that people may be less aware of, frontotemporal dementia. It's less common than Alzheimer, but it has a lot of impact in younger women in their 50s. And you see the illustrations here. So there's a bridge between what we say and the illustrations about what's happening in your brain.
Thank you, Dr. Gauthier. And as you mentioned, what makes this book so special are truly the illustrations that accompany the text. And the book was written in a way that it's very, very easy to understand. Oftentimes when people pick up, information about medical illnesses, medical conditions, it's difficult to understand, but we wanted to be sure that this book was written in a very reader-friendly manner. Now I'd like to invite my other colleague, Dr. Isabelle Jalina. First of all, before we go into the book, but what are some of the difficulties that people living with dementia can experience with regards to what we call activities of daily living?
Hello, Claire. Hello, everybody. As you've mentioned, there may be different difficulties and changes on how a person with dementia performs their daily activities. And this depends very much on the type of dementia, the type of problems that they're experiencing, whether it's memory problem or ability to perceive what's happening in their environment. But generally what we see is that as the disease progresses, there are changes in the person's ability to perform their daily activities. In the early stages that Dr. Gauthier was talking about a little bit earlier, usually the person will be able to do many of their activities, their daily life activities. But what we'll see is that they may start experiencing some difficulties, making some error when doing the activities. For example, somebody who is usually cooking but is using wrong ingredients. And then as the disease progresses, we will see people experiencing more difficulties in doing activities that are more complex. For example, preparing a budget, completing financial transactions, managing medication, or taking trips, doing groceries, even to the point of being able to prepare a simple meal or using appliances. And then in these situations, that's when we get more worried about the ability of the person to be able to stay alone at home, because these are all activities that we need to perform in our daily lives to be able to function. And then as the disease progresses more and becomes more severe, it's more what we call the more basic self-care activities that become more problematic. So taking a bath, getting dressed, grooming, all to the point of even feeding or even walking or going through the bathroom, for example. So the booklets really provide us with information and tips on how we can deal with different problematic areas in terms of daily activities. And Claire, you're showing some examples of different activities that are in the booklet. There's also, in terms of what we see right now on your slides, some example of tools or adaptations or ways, for example, for shoes to avoid lacing your shoes, to choose shoes that have Velcro or that are just loafers that you can go in. For feeding, you have different utensils that can be bigger, so easier to handle, avoiding buttons, zippers. So these are all types of examples that we that are provided in the booklet and that can be useful as the disease progresses to assist with these different activities.
So let's talk about safety too. And what I love about this booklet is it really takes each room and highlights some of the safety concerns, because I don't think people are always aware that as the disease progresses, that safety truly becomes a cause of concern. So maybe you can elaborate on that.
Yes, you're correct, Claire. As we age, but also with the disease progress, people will experience some difficulties with their balance, vision. We've talked about memory or being able to recognize objects in the environment. And this may bring different safety concerns in the home. One of the greatest risk is fall, and that's especially important when we're thinking about stairways, of course, but rooms such as bathroom and bedrooms. There are other dangers in the home that may be associated with food poisoning or toxic substances. Sometimes the person with dementia will no longer recognize what is toxic and what is usual food, and may mistakenly takes toxic substances instead of food. Or the person may not remember how to use certain objects or appliances, such as the stove or the iron, and that may be risks for burns or fire. So what's interesting with the booklet is that it takes you from room to room. And as Serge was mentioning earlier, the pictures are really well made so that you can right away identify what may be some hazard in the environment. For example, here in the bedroom, which is actually one room that there's quite a bit of risk of falls because we at night when we need to get up. So it's important to remove any loose object, carpets, to make sure that the furniture is at the right height to help the person get in and out of the bed easily. The bathroom is another example where there's lots of safety hazard with medication that needs to be stored. Making sure that there are non-slip object, that there are grab bars. So water temperature is another safety hazard. So it really goes through all of the different aspects of the environment that can be problematic.
I'd just like to ask Dr. Moret, I mean, because as you see patients in the various hospitals, I mean, there must be a large number of people presenting who have suffered falls and injuries as a result of dementia.
Yes, indeed. It's a significant risk factor for falls, reason being that they might pay less attention to certain details in the house. They might show some impulsivity, meaning taking very quick decisions without considering the risk of what they are doing. For all of these reasons, dementia increases the risk of falls. And 60% of all the falls takes place inside of the house, especially in the bedroom and in the bathroom. So it's of concern, and we have to make sure that the house is arranged in such a way to minimize falls, because there's consequences to falls, including fractures and injuries, obviously.
Mm-hmm. So, despite receiving a diagnosis of dementia, it's extremely important for the person to still take very good care of themselves. So perhaps, Dr. Jelena, you could begin in terms of maybe discussing some of the, activities that people can do. And then, Dr. Moret and Dr. Gauthier, maybe just talk about the importance afterwards of exercise and nutrition. So Dr. Jelena?
Yes, it's very, very important for the person with dementia to stay active and healthy. And this means keeping engaged as much as possible in daily activities and meaningful activities. And oftentimes it's really recommended to look at what are the activities that the person used to do in the past, what's their past interest, and try to stimulate and organize the environment for them so that they can do as much as possible, sometimes with assistance, but to be engaged in what really was meaningful for them. And you have on this slide a few examples of if the person likes to do board games, if the person likes to walk or to go on walk in nature. So there's different activities. Gardening is another example where you can organize the environment or simplify the activity so that they can still take part in those activities.
Dr. Gauthier, what would be your advice to a person receiving a diagnosis of dementia in terms of self-care?
It's to have a dialogue with your family and your friends, and also the treatment team. And it's something we're going to work on this year as we write the next World Alzheimer Report on post-diagnosis management, is how to have a constant interaction. This is based on my experience following people with dementia for like 8-10 year course. And a lot of the things we're saying now are important at a certain stage, but it's the first time we empower people now to plan ahead. And if we find they have hobbies they really enjoy and that could be sustained for a long time, it's something they can build on. Whereas for now, we just sort of have a 10 to 30 minute follow-up visit once a year, maybe twice a year, and we give a bit of advice. But this provides a continuity, a perspective that allow people to plan ahead.
Dr. Moret, I know that part of your expertise lies in nutrition and exercise. Perhaps you can say a few words about that.
Certainly, Claire, the issue of nutrition is an important one in this disease, especially in those who are living alone, because loneliness contributes to decreased appetite and we eat less. And obviously, if you are decreasing your food intake, and you will be missing important nutrients for the brain as well as for your muscles, and you're going to start losing weight and become more weaker with consequences for health. So it's important to have 3 meals a day and maybe a snack as well, with a diversity of different foods, so that we don't miss anything. And in terms of exercise, people tend to underestimate the benefit of walking, because walking is accessible to most people, contrary to running, for example. And maintaining a daily walking of 5,000 steps or more, which is about a kilometer distance, let's say 3 corner streets, it helps one to remain very functional throughout aging. So it's something of importance to eat well and to keep oneself active without necessarily to have to go to the gym,
Oh, thank you for that. And thank you, Dr. Jelena, for your involvement in this important report. The graphic illustrator actually surprised me with this image. It's an image of my mother and I write just a little personal testament within this companion booklet. And I have to say that when I saw the image of my mother and it moved me to tears. And so it was very, very special to be included in here. And so the next part of the booklet is very important because it really talks about caring for the caregiver. This is something that unfortunately is so overlooked. We have the tendency as care partners to put ourselves last. So, an entire part of the booklet is really devoted to care partners, how to take care of ourselves, and there's a real good section devoted also with regards to managing challenging behaviors, understanding why the person is behaving the way they are, what could potentially be causing, I know that during COVID and isolation, a lot of people are lacking resources and lacking information. And that's really, I think, when I work with families, that part of it is really about why is the person doing what they're doing? Why? And so a big part of the book is devoted to really how to respond to those triggers. How do you communicate better? As a caregiver, what do we need to do to get better care of ourselves? Because the only way to take the best care possible of the person that we love is really about, or that the person that we're caring for, because not everybody is necessarily a family caregiver. You can have a neighbor caring for a neighbor, a nephew caring for an uncle or an aunt. But it's really the core of everything that we do is really about caring for ourselves. And so it was very important, and we worked closely actually with the Alzheimer's Society of Montreal on this section to really provide tips to the care partners in terms of what they need to do to take the best care possible of themselves. So that was and you'll see that as you download the booklet. So I think a very important question that everybody has right now is, how do we get this booklet, right? Where is it available? So this is the link to our website. And if you go on our website and you click on the Dementia Companion Guide, it's going to be currently available to download in English and in French. But I'd like to now go back to Elise and really thank her for this donation, but also to say that this booklet is going to be available in multiple languages. So why was that important to the Grey Start Foundation?
Well, multilingual, multicultural, that's our community. And we felt that the more people we could help, the better. And you've described this many times in our discussions over the last few years as a prescription for care. And I guess at the foundation, we really resonated with that and made the decision that language should not be a barrier for proper healthcare, and that's the main reason why we were so keen to come back and say, hey, let's do this in many more languages. And I think probably from listening to me a little bit today, you're realizing that the foundation supports forward-thinking and creative projects. I would invite you, if on your computer, to check fondationgraystart.org. We are an organization that has a a long history in Montreal, and we're here to grow and help the elderly as much as we can. So thank you all.
Well, I'd like to thank you so much once again for your this amazing donation, and so that we can create this important resource that will not only be used by family and informal care partners, but it will be used by the medical students, by the allied healthcare professionals, by hopefully by seniors residences as well, to provide some training to their staff. But it's going to have, and it will be seen around the world, thanks to McGill's involvement with Alzheimer's Disease International and the next two world reports, this one that was just launched and the next world report that's launching on post-diagnostic management and support. So thank you very much to all of my guests for being here on McGill Cares. I'd just like to remind everyone that this webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. I would like to thank once again the Grace Dart Foundation for today's webcast. To make a contribution or for more information about our program, please visit us at mcgill.ca/dementia. If you would like to join our mailing list to be notified about upcoming episodes of McGill Cares, as well as important programs and resources from us, you can sign up at dementia@mcgill.ca. Thank you for watching.